My name is Dorothy Toomann, and I work for the Development Education Network Liberia, a non-governmental organization that was established in 2000, focusing on promoting democracy, peace building, all in the effort of promoting a Liberia that will be at peace with itself and its neighbors. This Ebola crisis in our country that started in March this year has really brought a lot of concerns that need to be handled if we are to move ahead in our peace building and development processes. Since the Ebola crisis, we have had more than 6,000 cases nationwide. Of the 6,000 cases, Bong County, where our institution is based, more than 300 cases have come from here. We have had more than 2,000 deaths nationwide, and this community that we work in, that we are based, have had about 100 deaths. This Ebola crisis have broken homes, have left children without parents, have separated families, have divided communities. In an effort to prevent Ebola, we got the message, or we are giving the message, that nobody should accept strangers. And our culture in the Liberian society, if we live as community people, that's why we have not just our immediate family, but we have a vast extended family. And this extended family relationship creates the opportunity for anybody to walk in your home anytime as a family member, to be welcome in your home at any time as a family member. But as a result of Ebola crisis, we are preaching the messages that nobody should allow stranger, nobody should cater to sick people. And these are some of the things that are unfolding in our community. Our health system is weak. Based on that, culturally, people have to treat themselves using herbs. People have to take care of their sick people at home, do first aid treatment before they can even take the patients to the hospital. The health facilities are far away, so people have to walk to go to some of the places, sometimes one hour or more. Now, with Ebola crisis, we are telling people not to touch the sick. So sick people who are surviving, even from Ebola, feel some sense of resentment, in addition to the stigma that is attached to the Ebola disease. So communities and people are feeling that the time they needed other family members most was when they had to stay away in the name of protecting themselves against the disease. So there will have to be a lot of work done to reunite families, to reunite communities, and make sure that our peace building process, our development processes continue. Another aspect of it is that the whole economic breakdown. In Liberia today, my own organization runs 3 co-programs with other small grant programs. But today, the only aspect of our program that is running is the theater aspect. The outreach for peace, which is responsible for public education, civic education, is the only program that is running today. With the other programs, we have to run them low profile because we have to withdraw our monitors from Infi, and they sit home or at the office and do monitoring for a few hours. And this is exactly what is happening to organizations in Liberia, most organizations in Liberia, including government agencies. So a lot of people are out of job. My own institution right now has about 11% totally out of job because the way we raise money to be able to cater to their needs, we no longer have the opportunity. We run a training center that takes about 50 persons in service training, and we have a guest house. But this training center, since July, we have not had the opportunity to host one training. So it has become so difficult at the local level. Business people who cross the border to make business no longer have the opportunity to do that. Kids are out of school. All schools are completely closed. The hospitals that are functioning don't have enough material, especially to protect themselves from the contagious diseases like Ebola, like Lassa fever. So, but we want to be thankful to the international community for stepping in, because through their efforts, through their support, we have been able to move some way forward. Part of what we will also be focusing on in the future will be around strengthening our health system, strengthening our education system, and even agriculture. This is one of the things that had a disease to really penetrate our society, because Liberia is not food secure. We import, if not 75%, it will be around 85% of the food we eat. And closing our borders meant a lot. So we had to keep the borders open just to create the opportunity for food to be coming in from neighboring countries when we knew very well that there was Ebola outbreak in those countries. So if Liberia is to move ahead in the future, it has to pay attention to agriculture, to that sector, and make sure Liberia is food secure. Even today, there is this civic education message that people should not eat meat. But meat is the main source of protein in Liberia. Liberia being one of the poorest countries in the world, it is very difficult for people to meet their basic needs. But again, if we could use this Ebola crisis as a platform, which is very difficult, yes, but as a platform for strengthening our systems, the system of health, the system of education, the system of the agriculture sector, and even infrastructure, I think Liberia will be on a good footing in moving forward. Again, let me just say thank you to those of you in Ireland. You have supported our work. You continue to support our nation. But we need to be very strategic in the way supports are given to ourselves and our nation, so that we're building more sustainable nation, and that we are concerned about the future, not just today, which is what matters most, because as we are here today, there's a future to this nation. And if we don't see it that way, our work will continue to be short-term, and the short-term work will continue to undermine sustainable peace and development as we move ahead.